The guys that I play with at church, it's a big group, but there's several of us that have been kind of core members. And a couple of them got asked to play out at a town fest. And they said, hey, do you want to come play too? I said, sure. And we started playing a little more routinely. And then we started getting asked to play at these town fests, and they would ask what our name was. And Jack Browning, who's our DA but plays with us, he said, just tell them to call us whatever. And so the first couple times we played, they put whatever on the, on the listing. And of course, my mother hated that, so we had to change it. But so McPherson Street was born. We all lived off McPherson Street, and our church is off McPherson Street, so we decided that was easy enough. Sitting down, playing some music with friends just really helped me unwind. So it's just a fun side thing for me that just keeps me balanced. So my early medical, exposure was that my father passed away suddenly of a heart attack at 44. I was 12 at the time. He had had chest pain for a few days, actually had seen his physician, and they thought it was maybe a pulled muscle and just said, but if it gets worse, go to Emory, and then, stayed home and died suddenly. So, that kind of experience and frankly, even a little bit of the question of care got me interested as far as how things happen in the medical system. And then in college, one of my college roommates my freshman year was diagnosed with cancer and battled that for several years and unfortunately didn't survive. But again, just working with the different doctors that she saw and the exposure there and what a positive effect that the health care system can have even in a situation that doesn't have a great outcome. It was just very eye-opening that there are so many different roles that a physician plays, not just the medical science side, but also the emotional support, the spiritual support. I went to school on a scholarship through the Georgia Physician Workforce and knew I would be doing primary care for a certain period of time. But the reality of it is, once I got into training, I really just enjoyed a little bit of everything. I didn't want to limit myself, and there's so much variety on a daily basis, and it just keeps my job from ever getting boring.
Dr. Eubanks is an incredible person, as well as an incredible physician. The compassion she has for people is unmatched. She has a servant's heart. She's compassionate. She's charitable. And she has a real passion for being a physician and helping people that are in need.
So I've been with primary care of Bremen for several years now. I've actually been with Tanner for going on 14 years and just felt like it'd be a good fit, and it really has been. It's a rural health clinic, so we see a lot of Medicaid, Medicare, so the reality of it is the patient population we see here is my cup of tea. There are ones that have a lot of psychosocial issues we have to take into account. There are ones that have, probably on average 5 or 6 chronic conditions when they're coming in. And, so it's interesting, it's a challenge, and it's here in my home community.
Because they won't see her until she gets the indigent packet. Okay. So as soon as she does that, then we'll fill out for the surgery group and I'll be a lot for her.
Get Healthy, Live Well is a Tanner initiative that Dr. Eubanks has grabbed a hold of and has just run with it. She is a true advocate for the patients for Tanner to make sure that the available resources, the education, and everything that we can provide our patients is there for them.
My understanding is that Dr. Amy will refer the majority of her patients to programs and probably has a better follow-through rate than probably any other doctor in the area. I'm not sure exactly how she does it, I've just heard the results of it. And I think that speaks to her passion, again, and to her purpose of just trying to serve the community. I think that's the only thing she knows.
We realized early on with the Get Healthy, Live Well program that if we were truly going to help people deal with their diabetes and blood pressure, just all the various chronic diseases we have in this area, we were going to have to go to the people where they were and really overcome the barriers to care, the things that kept them from being able to do what they're supposed to do. And a lot of it was just education that we don't have time to always do on a regular office visit. And so as a committee, we helped oversee doing classes, a variety of classes, to reach the patients in the community and teach them the things they needed to know to be successful in their own health care.
I've witnessed the fact that she provides the education, the tools for the education. She provides the patients with the knowledge to be able to make the right choices. She definitely walks them down the path to make the choices that are going to have a better outcome for their health.
My grandmother used to say everybody needs a little success. And when they see their numbers improve, they see their weight come down, then they're more engaged. But it can't really get started, it can't get off the ground unless they truly understand what they're supposed to do.
The healthy living programs at Tanner Health have been very instrumental in educating the area. They have also utilized, because of a relationship with Dr. Eubanks, to be able to use some of those same programs at Rafa Clinic.
Dr. Eubanks donates a lot of her time to the community services, Rafa Clinic being primary location. She is always rallying the troops to make sure that other physicians participate. So she is a lead role in providing that service for our community and our patients that otherwise would not necessarily have access to health care that they could afford.
Hey. Hey, Naomi, I'm Dr. Eubanks. Nice to meet you, too. You been feeling pretty good overall? Yes.
Rafa Clinic's been around, in February will be 10 years, and it's basically, in the simplest form I can get it, is neighbors helping neighbors with health care.
The word Rafa itself refers to healing on multiple different levels. So we're there to help them both medically, but also spiritually, emotionally, and just giving them the encouragement that things can be better.
Amy has a way of connecting with people, and I've seen it firsthand as she relates to the patients, that she takes the time to listen and then to give them a chance to just be a person.
But people don't show up to a doctor's office because they don't want to be healthy. I mean, they show up because they want help. And once you kind of get a feeling for the overall package, because it's not just about what condition somebody has, it's about, can they afford their medicines? Do they have a social support network? Because that is highly important when you talk about making lifestyle changes. You need people who love you, who are going to help you be encouraged to do it.
Dr. Eubanks, she will sit down and talk to you, and she will ask some prying questions, and she'll try to dig deep and figure out exactly who you are. She wants to know the person that she's treating, not just the patient that's there.
Rocky came to me when he first turned 50 and just wanted to get healthier, just kind of see where he was, but he had a lot of challenges and he had several diagnoses.
First time I went to see her, we sat in the office, and she treated me more like a person than like a patient. She spent about 30 minutes with me. I've never had a doctor spend that much time. I was overweight. She got me to join the diabetes prevention program, and I joined it, figured out how I was eating all the wrong foods. I wasn't exercising near enough, so I started trying to eat properly and started going walking and hiking, and started melting some pounds away. I was also very depressed. And she read that, and she knew it. She really can read people.
When it came down to motivating him to take better care of himself, the fact that he was a little depressed was really playing into it. I felt like the classes not only would help him understand ways he could help himself, but it would also be something for him to do socially that was going to be healthy for him, both psychologically as well as for helping him treat his chronic medical condition.
9 years later, I weigh like 20 pounds more than I did when I got out of high school. And I don't smoke, I don't drink near as much, and I just feel so much better mentally, physically, and It's all because of her.
Rocky really is a great success story. He has done an amazing job. And again, my grandmother's always said that everybody needs a little success. My mother says it to this day too. And I think what he needed was some success.
The Get Healthy, Live Well program, I believe everybody should attend it or get involved with it. It's changed my life. She means a lot to me. She really does. She deserves the award. She's definitely a health hero.
Congratulations, Dr. Eubanks. You're an incredible physician, and I'm honored to work with you.
Congratulations, Amy, on this award, and thanks again for the many things that you've done for me personally and for the Rafa Clinic community. We really appreciate your involvement and your passion and your dedication to the community.